My role for patients and families is to provide support, advice, help and reassurance anytime they need it. Activities can range from clinical advice, symptom management, navigating their local services, help within the schools, liaising and communicating with other healthcare professionals, identifying lead professionals in their healthcare, and also providing emotional and practical support to the patients and their families and extended family members as well. Recently I've been working with a family of a newly diagnosed young child. The family have required a lot of intensive support, ranging from emotional through to practical support. We've helped to rehouse this family into a more suitable and appropriate property for the family and get them some equipment they need for their young child. And I attend clinic appointments with the family on a regular basis so we can provide support to them through those clinical appointments, and then take some time afterwards as well to speak to the mum and dad and ask if they've got any questions and if they require any support following that clinical appointment. We work in partnership with many healthcare services, but in particular speech and language therapists, occupational therapists, local councils, schools and the specialist centres throughout the UK. Elizabeth and Steve are my colleagues and we work very well together. They can provide support for families on the non-clinical aspects of the condition, so help with adaptations and equipment, benefits, and also to provide the extra sort of emotional support and getting to know the families as well.
My role is to offer families non-clinical advice and guidance, so I work alongside our clinical specialist nurse, but my role is to offer emotional support or support with advice, pensions, education, housing, basically all the practical things and the emotional things to help people with their journeys with NPC. My background has been as a social worker. At the moment I'm a registered social worker and I've always worked with children and adults with disabilities. So it was very natural for me to progress onto working with people with genetic conditions. And I felt when I saw the job advertised many, many years ago that it was the right job for me, and it just clicked from day one basically. I can help families with lots of different activities. So I'm quite aware that with it being a rare genetic disorder, people are very isolated. So I've kind of made it a mission within NPUK that families have opportunities to meet with each other as many times as possible. So we have this wonderful conference that people come to every year, which is brilliant. But we also have two other activities, which is a Christmas party and also a summer activity. These are not disease related, they're purely about fun, making memories and getting everybody together and just having a wonderful time. A lot of support has been given with benefits and housing. At the moment a lot of people are struggling with the benefit system. We've had people moving from disability living allowance to personal independence payment, which is called PIP. A few of our families have had to fill in these quite new forms and had very stressful conversations with departments of works and pensions over the phone, wanting to have face-to-face meetings and assessments. I've been able to link in with Department of Work and Pensions and stop these assessments happening because they're very, very stressful and something that our families don't need. So I've been able to help people just navigate that system because it's new for me as well, but I have to make sure that people are being heard and that they're not losing their right to benefits. I work very closely with both Laura, our nurse, and Steve, the families officer. With Laura, she manages all the clinical side and I manage all the non-clinical. So we work very well together. So we can, between us both, totally support a family with whatever needs they have. The families bring new challenges to me and I enjoy researching what I need to do and working out how I can support them. I do feel very honoured, and I say this all the time, but I do mean it, very honoured to work with these people who are very brave, resilient and just very lovely. I'm very, very lucky.
My role for families is offering support emotionally and practically for all those affected by the illness, but not only those affected but also distant family members, siblings, mum, dads, parents, grandparents. As I'm fairly new to the role, I'm just building up a network for the male members of the community. I'm looking at various activities from sporting events to regular meetups, and we're just developing a youth programme for young voices and volunteers. And then hopefully we're going to do a regular sort of meetup every few months up and down the country. One of my main aims as well was to reach out to hard to reach families, especially those in the black and ethnic communities, and also with the male groups, male members of the group. And so we have got a small male group together for those that have been isolated from up and down the country, and we are using social media to link those members in and then get them to be part of the community really. And the ultimate aim is get them to conference every year.